Dear esteemed chairs, dear PhD students, guests and supervisors, welcome to the 15-month progress report here at the Center for Translational Medicine at Semmelweis University. As you know, we all started our PhD with different missions and visions, but today we gather for one clear vision, which is science into healthcare. And our mission is to make a breakthrough change in patient care and scientific education. We believe in innovation as an opportunity to see change as an opportunity, the ability to see change as an opportunity, not as a threat. So our aim is to provide you opportunities to apply new knowledge and skills by practicing as realistic settings as possible. The new cycle model of the translational medicine been established some years ago, containing 4 main domains. First, we have to choose the best clinical question to ask. And then we have to learn the different methodology designs to answer this clinical question. And we always say it doesn't matter how important your results are. If it's not written and published, no one can know about it, and it can't be implemented into clinical practice. The results of the translational medicine being published in the highest quality journals with the collaboration with international colleagues and Nobel laureates. If you look at our PhD program from 2019, we started roughly with 20 PhD students per year. However, in the last 4 years, we have roughly around 90 PhD students started our PhD program per year. You finished the golden year 3 months ago, where you had 4 days dedicated for scientific activities and 1 day into clinical practice. And in the last 3 months, you started your second year, where you had 4 days into clinical practice and 1 day dedicated for your research activities. We recommended you to use this time wisely, as our expectations is going higher with time. We started with 100 applicants. 89 of them got admitted into our PhD program. We usually divide the year into 4 phases. Each phase is basically 3 months. And phase 1, 89 students started that with one strategy, which is learning by doing. In the first 3 months of our PhD program, we learn how to find the most important question to ask. And we learn how to simplify it so everyone in the room can understand it, and how to choose the best methodology design to answer this clinical question. And our expectations after the first 3 months that everyone started drafted their PhD thesis, everyone learned the different methodology designs, including systematic reviews, meta-analysis, clinical trials, and registries. And of course, everyone has reached at least the data extraction. We always have some exceptions based on the project size and complexity. 87 students passed phase 1 and moved to phase 2 with the same strategy, learning by doing. Within 6 months, we expect the student to learn how to write the article and how to communicate the results professionally and how to discuss it critically. The expectations after the 6 months that everyone expected to complete their search, to show some results, and of course to show their achievements. 86 students passed phase 2 and moved to phase 3 with the same methodology. During this phase, you had the opportunity to meet and talk to top researchers. And we expect from you to submit your first paper, to complete your data summary, and to show your achievements. 85 students passed phase 3 and moved to phase 4, where we are expecting the student to complete project 1 writing, to start their second project, and to submit your first project. Of course, as I said, we always have some exceptions based on the project size, statistical complexity. In phase 5, in the last 3 months, 84 students started this phase with the same strategy, learning by doing. Our expectations that you complete your first project article writing, you submit your first paper, and you advance in your second project to reach the data extraction and maybe show some results. This is the current status of Year 2 students. We have 68 projects with final results and currently with article writing. We have 44 projects where the manuscript is finalized. We have 36 projects submitted. 5 of them got accepted and published already, and 4 of them is currently going under revision. This is the statistics for Year 2. We have 89 students accepted in our PhD program. We don't only have medical doctors, we have dentistry students, we have pharmacology students, even space science students. 178 projects started 15 months ago. I want you to imagine the clinical benefits if we could answer 178 projects and the results that can be implemented into clinical practice. We believe in evaluation and feedback, so I ask everyone to scan the QR code after each presentation and evaluate each other based on the presentation skills, discussion skills, and overall impression. We believe in innovation, so as we always say, that if you could answer or ask 3 clinical questions during the day, you will get a certificate of excellent questionnaire and a bottle of wine. Of course, we don't only improve in scientific activities, we also establish the social club and the sport club and the art club. We always invite you to join us with these activities. We had the opportunity to meet some top researchers in the last few months. One of them is Ole Peterson and Martin Chalfe, who is the Nobel laureate in chemistry, and Shahrukh Shariat. The next seminar lecture will be in April 8th. I would like you to save this date. We have 5 seminar lectures, distinguished guests, and it's going to be from 1 p.m. to 5 p.m. in this room. Your complex exam is approaching. As you know, you must have 16 credits in your Neptune, so we kindly ask all the students to check if you have these 16 credits, including the Translational Medicine PhD program courses, and you must have at least 1 submitted paper. There will be no exceptions in these cases for the complex exam. The written exam is going to be on the 16th of June, and then from 17th to 20th, we will have just like the progress report, and we will send you the detailed program later. Our next PhD thesis defense is going to be on the 22nd of April. I also kindly ask you to save this date since it's mandatory for our PhD students. Believing in yourself is the first secret of success. However, with a clear vision, commitment, and hard work, we guarantee you success at the Center for Translational Medicine. I will leave you with this slide, some statistics of our PhD program in the last few years. We already achieved our biggest milestone to achieve 1,000 impact factor, but we have 1,300 cumulative impact factor so far, with hundreds of papers being submitted and published. And here you can see some of the top published articles from our own students. We could publish in the highest quality journal, including JAMA Oncology, JAMA Pediatrics, Gastroenterology, eClinical Medicine, which is part of Lancet, and JAMA Network Open, and many more. With this, I wish you a successful event, and I officially pass the mic to our esteemed chair to start the first session. I wish you the best of luck, and I'm looking forward to listening to your presentations. Thank you so much.